This is Arab Talk on KPOO San Francisco, 89.5 FM. This is Arab Talk with Jess and Jamal. I'm Jess Ghannam.
And this is Jamal Dajani.
And we're reporting again and doing Arab Talk Radio again from our quarantine locations in Northern California in order to continue to honor the recommendations of the state of California and the CDC. Jamal and I remain on strict self-quarantine at this time, but we're committed to bringing Arab Talk to our listeners, and we're going to continue forward, Jamal, because this situation, despite what you're hearing from the White House, which in my opinion continues to be very dangerous and very kind of reckless. I'm using that word a lot because we're all very concerned about what's going to be happening in the future. The talk of reopening the economy and reopening things, quote, back to life, at this time continues to be, in my opinion, a very reckless endeavor. We're going to be talking about that today. We're going to be talking about the new normal, whatever that looks like, because in my opinion, Jamal, the concept of returning to normality is a kind of will force us to rethink the entirety of our way of socializing, of being in the world, of engaging with each other. Because the news that I want to let our listeners know, this coronavirus isn't going to go away. And even if we get a vaccine, which in my mind is really the most important thing, even when we do get a vaccine and we all get vaccinated, the coronavirus, whether it's a common coronavirus or a novel coronavirus, it's going to be with us for a very long time. We're going to be susceptible to these kinds of infections and pandemic-like exposures for the foreseeable future. So I feel like our obligation on Arab Talk is to put all that out there, engage in a discussion, put it into the larger political context, and hopefully talk a little bit about how that relates to what's going on in the Middle East.
That's right. Jess, I have a lot of questions to ask you about this and to ask you about what is the new normal and to ask you about the new tests that they have been using, like the new Abbott test that gives you results in 15 minutes. And we will be discussing many of these things, just a few updates for our listeners. Now, the global cases are 2.1 million globally around the world, with 141,000 deaths. And unfortunately, in the United States, we have 641,000 cases with 31,000 cases of deaths. And as you've mentioned, the news here in the United States are very for obvious reasons, they are very US-centric. And we want to bring other voices. We want to bring global voices, mostly from the Middle East and other Middle Eastern communities from around the globe, to discuss what's going on there. Also talk about the Arab American community, which I'll come back to that because I've been researching that we don't have a lot of reports about what's happening to the Arab American community in the mainstream media, except, we find out about things from social media or through friends, like people who have been affected. We know that doctors who have been fighting the coronavirus in New York and New Jersey, unfortunately, have passed away. Right. Because of this. So we definitely need to talk about this. So our first interview, Jess, we've had the honor to have this interview with the award-winning journalist and former Ferris professor at Princeton University, our friend Daoud Kuttab, who we've had on this show before. And so we talked to him in his shelter-in-place in Amman, Jordan. And people who know about Daoud travels between Amman, Jordan, and Jerusalem in Palestine. And so he gave us this report. So this is what Daoud Kuttab had to say. So, Daoud, you're at Amman, Jordan. You travel, of course, between Jordan and Palestine. And first, let's talk about what's happening in Jordan. I've checked this morning. It seems that at least it was reported that there are 400 cases. I don't know if the numbers are accurate or not. But how are people coping, and what's the government doing about it?
Well, the government has taken a very strict and very strong position. The military order or defense order was established mid-March, and we've had 6 orders so far. The government has put a round-the-clock curfew almost since then, since the March 21st, actually, and they're starting now to ease things, but it's been a very strict army-controlled situation, and that has kept the numbers down. As you said, we have less than 400 cases. About half of them have already been healed, so we're actually down. The curve is going down. 7 deaths have happened, mostly older people with pre-existing conditions. So generally, I think they've done well. Most of the public has adhered to the curfew orders. There have been a few cases here and there, but largely it has worked very well.
And I've been watching like some good things happening from the government, seeing the Jordanian army in certain cases bringing bread and water to neighborhoods, and people helping each other in different ways. A lot of heartwarming stories coming out from there.
Absolutely. It's been very, it's a perfect story. As you said, the army has actually taken on a social role of helping people out. The army is not doing it out of spite or out of restriction, but out of really protecting the people. So people have been very much greeting and thanking the army for what it's doing. And yes, bread and water has been actually, there's been too much bread. People are actually giving away bread at local supermarkets. The government, it did an interesting thing. They allowed local supermarkets and shops to open, but they kept the big ones closed, and they kept the cars closed off the road. So basically, you can walk to your nearest kind of 7-Eleven type store, if you will, and buy your milk and bread and eggs, and you don't need much more. I mean, you need to live kind of a simple life, which in a way is good. And as you said, neighbors have been helping out, churches and mosques have been helping out. Lots of initiatives of local committees are being established to help out people. We have in Jordan 10 million population. 3 million of the population are refugees or people or foreign laborers who don't have actually a regular job, and they're not on Social Security. So there's a lot of people who need help. Almost all the taxi drivers are self-employed, and they are totally without any income. So there's a number of sectors of society that are really hurting by this. And people have all to learn how to live with less, and learn when they go shopping that to stay distancing from each other. There's a lot of hand washing that is being taught and learned, and basic hygiene issues are learned. And the army and the government move very fast whenever there is a discovery of a family or building that has infection. They really close it off, and then they test everybody, and then they make sure everybody is safe before they can go back. In the beginning, they opened up the 4- and 5-star hotels where people coming in airplanes basically were forced the quarantine. My daughter was one of them. She came back from Princeton, and they took her right to the Dead Sea, and she stayed in a room overlooking the pool, but she couldn't get out of the room. it was quite difficult. But anyway, it was welcome because the government really went out of their way, and a lot of businesses have been contributing money, and there's been different funds that have been established. Tens of millions of dollars in JDs have been put aside by big companies, banks, and so on. And individuals, you can donate as much as $1 on online now. 70% of students are studying online. Many companies, my company included, have been doing. I have been working out of home for the last 30 days, and I haven't had to go out much for anything except to buy bread and milk and things like that. So things are not good economically, but I think there have been some remedy to the big problems.
I forgot to wish you when we started Happy Easter, and this is something. I mean, we're all kind of like we all miss celebrating holidays, and I was worried about people across the globe, especially in the Middle East, Jerusalem, wherever, where people go to churches, and especially in Jerusalem and in Jordan, celebrate Easter. So how was that done?
The big problem, of course, is going to be the Passion Week in Jerusalem, as you said, because it's very physical. The Via Dolorosa, the people, the walk of the cross, and the washing of the feet, the different celebrations, and then the holy fire that comes out of the Holy Sepulchre. You cannot do that virtually.
Talking about Jerusalem, what's your impression on what's going on in Palestine? In Palestine, I've checked today. They say they have about 300 cases, but then people have been complaining. They feel that maybe the numbers are too low because we've recently witnessed a spiking in the Jerusalem neighborhoods, like of Sur Bahir and Silwan. Any updates on this?
Well, there's two things here, Jamal. I mean, the big problems are actually Gaza and Jerusalem, because they are communities that are not easily regulated, very densely populated areas, and so the fear that once the pandemic reaches these places, it'll be very hard to control it. So far, it seems that Gaza has had very few cases, and they seem to have isolated them. But as you said, there's very few testing going on, and so unless people are actually having the symptoms, you don't know what is happening. The second problem is that a lot of the workers who work, there's about 70,000 Palestinians from the West Bank and East Jerusalem who work in Israel, and Israel has had a very high number of people who have the corona, and so during the Jewish Passover holiday, they all returned, and there was an attempt to try to control that, and then it was the Israelis were not very cooperative, so people were coming in uncontrolled, and they were trying to isolate or at least test them or make sure they don't have the symptoms. So that is a problem. But I would say that Jerusalem is the biggest problem because it is the kind of forgotten area, East Jerusalem specifically, because the Israelis paid very little attention to the situation in Jerusalem on the Arab side of the city, and the Palestinian government has not been allowed to work there. And the few efforts by the Palestinian officials who live in Jerusalem have been thwarted by the Israelis, who arrested the officials, saying you're trying to use the pandemic to, for political gains, and they actually literally intimidated him, beating him up and forcing him to wear a mask with blood on them. And it was quite nasty what they did to Mr. Fadil Hidmi, the Palestinian Minister for Jerusalem Affairs, and also Adnan Ghaith, who was also arrested. So the Israelis have not been cooperating or allowing the Palestinian government to work. And as a result, in an ironic way, the Israelis have helped create local committees that we used to have in the Intifada days. You remember, Jamal. Now there's a local committee that are being established. There's the alliance of the Tajammu al-Maqdisi at Jerusalem Alliance of about 71 NGOs that are working with the WHO and with the Jerusalem hospitals to come up with a plan, and they've made quite a good plan. They've designated hotels to become quarantine hotels. One is for the doctors who come from the other West Bank cities, and instead of them going back every day, they decided to keep them in Jerusalem for their own protection, so they don't have to go cross checkpoints every day and so on. And they're trying to raise money. The hospitals need about $7 million to buy the ventilators and the personal protective equipment. And so they have, I think they've raised about $3 million already. So that's quite good. They still need some more. And I'll call your audience if they're interested to support the hospitals in Jerusalem. And there is attempts to create a lot of awareness. The big issue is awareness. The more people are aware, stay home, clean, wash their hands, and stay out of big groups, I think that's the best kind of protection against this pandemic.
And there was a story that Israel, of course, I should mention Israel has 11,000 cases as of today, that they've been procuring medical equipment, utilizing the Mossad, basically, There was a story about how they've been getting that, and
And they got some bad equipment also.
and they got some bad equipment.
Testing results that were bad. Unfortunately, the Israelis have politicized this issue, and especially in their relationship with Gaza. They're trying to blackmail the Gaza population by saying, we will give you the ventilators if you release information about some of the Israeli soldiers that were held by during the conflict. And apparently there's some kind of a discussion about prisoner exchange. So, it's quite interesting, but in a way sad that this pandemic is used for political reasons, whether it's with the Palestinians or even in the Israeli government establishment itself. There's a lot of politicization of this issue.
Thank you, Daoud, and stay safe and healthy, and hopefully we can talk during better times.
My best to you and your family, Jamal, and everybody who's listening and watching us. I hope things are better the next time we talk. Have a good day.
You too. Thanks.
All right. You've been listening to the voice of Daoud Kuttab, international journalist from his quarantine location in Amman, Jordan. Daoud has been a regular here on Arab Talk. We value his opinion. He goes back and forth between Jordan and Palestine on a regular basis. And I think, Jamal, his insight and his perspective are really kind of eye-opening to us to hear about some of these things from the Arab world perspective. I know we've been focusing more on kind of the local perspective here in Northern California in the United States, but this is affecting everybody all over the world, obviously, and we don't hear a lot about what's been happening in the Arab world.
Well, what I got from him, number one, that in Jordan, they're trying to do the best they can do and to prevent people from coming out. And the government has been very cooperative, and people have been cooperative with the exception of few cases. And it's very scary there because the economy is devastated and has been devastated for a while because they have high unemployment rate in Jordan. And then with this, Jordan, as you know, is dependent on international financial aid, especially from the United States and the EU. So I don't know how, if they're going to receive enough, especially now the entire world is going into a recession. So that's going to be a big question. The other thing is which we reported on this, is now we're seeing what's going on, how far Israel is going to push the occupation and the apartheid regime conditions.
Exactly.
And the biggest example of this is what's going on with Jerusalem. And Israel claims that Jerusalem is its eternal capital, that it is a united city. Yes, yet it basically distinguishes and differentiates between Palestinians who mostly live in East Jerusalem and Jewish Israelis who live in West Jerusalem. So what they have been doing, they have not been doing anything to help Jerusalemites in East Jerusalem. Very little is going as far as to assist their hospitals. And as Daoud Kuttab was saying, and when Palestinians try to organize and try to open clinics to test people, the Israelis shut them down.
That's right, Jamal. And we need to call it what it is. It's medical occupation, it's medical oppression, and it's using the medical system and access to healthcare as a tool of the occupation and as a tool to oppress and further the ethnic cleansing of Palestinians in Jerusalem, Jamal. I find it so disturbing that despite the fact that Palestinians living in Jerusalem pay into a system to have access to healthcare and are supposed to get the same access as everybody else, are being denied this access and being denied the opportunities to protect themselves from this no borders coronavirus. Even though the Israelis can build a wall, Jamal, the wall doesn't keep out the coronavirus. And so I consider the use of medical occupation and kind of denying people the access to medical care, a particularly morally bankrupt aspect of the Israeli occupation and how it's being carried out in Palestine right now. It's really so objectionable, it's hard to put words to it.
So although the numbers have been relatively low when you compare it to other parts of the world,
right,
in Palestine, because we talked about it, Palestinians are very cognizant about the situation, and they believe in science and they rely on doctors. However, we've been seeing a spike in the numbers in certain neighborhoods of Jerusalem, like Silwan, where Silwan, as we know, has been taken over, or almost 1/4 of it has been taken over by Israeli settlers, very, ultra-right Israeli settlers that have taken many of the homes. So, not surprisingly, the numbers of Palestinians infected in Jerusalem are in Silwan, the largest number.
Right.
So, and other areas also where they have into contact with Israelis directly or indirectly, like in Sur Baher. And that's very dangerous because these Palestinians who live in Silwan, they don't go to West Jerusalem to do their shopping.
That's right.
They go to East Jerusalem. They go to the old city. So even with the minimized traffic and people going out, they still have to go buy bread and milk and meat and whatever from the store. So now I'm really concerned. I've been very concerned after I saw, I think in one day, they had like 10 or 12 new cases in one day when they had 0. Okay. So I'm really concerned that these people who live in these areas are going to come into contact and spread more of the pandemic in Jerusalem, especially in the Old City. And we talked about how the Old City is very crowded and has narrow streets. And if something like this happens, it will be a very dangerous situation.
Well, Jamal, I really do share your concern because if it gets into the Old City, and if it gets into East Jerusalem, if it gets anywhere in that vicinity and they get to any point close to a tipping point where more and more people are going to get infected, it could have disastrous consequences. And this is where the Israeli use of medical oppression and occupation is going to come back to haunt them, and they better get their act together because the virus knows no borders. So if this COVID-19 gets into the Old City, it's going to infect a lot of Palestinians, unfortunately, but it will also affect a lot of Israelis. And so they need to get their act together. They need to make sure and guarantee that access to care, access to testing, which is really the key here, is universal. It's part of the occupying power's responsibility, as we know, Jamal, to provide these services, even though for over 70 years they've been reneging on their legal and moral obligation to take care of the occupied Palestinian state. So I share your concern. I think time will tell. An increase from 0 to 12 in Palestine, if you were to do the numbers and compare it to the United States or New York or San Francisco, that is a big, big jump, Jamal. So we have to be very concerned about it.
Yes, and then the other, of course, part about how Israel uses, basically, control over almost 2 million Palestinians living in the Gaza Strip. Just when it comes to food, when it comes to power, when it comes to electricity, when it comes to travel. And now with this, and even though we know that the numbers in Gaza are low, what do you think the ramification would be, God forbid, if the pandemic seriously spreads in Gaza it's going to be like we talk about the infection rate in prisons in the United States, multiply that by what, 100, 200?
That's exactly right, Jamal. And I've been working from my remote locations with my colleagues in Gaza right now, thinking through and working on various things that can be done within the context of a brutal blockade that the Israelis have been engaged with Gaza for, 15 years now. There is a economic blockade. There is a medical blockade. There is a food blockade. I mean, Gaza, as we've been saying multiple times here, is an open-air prison. So with the amount of cases that are happening in Gaza right now that we're hearing about and that I'm hearing about, at this point, we need to be concerned, but we don't have to, kind of ring the bell with extreme urgency right now, because not to anything that the Israelis are doing, but the Palestinians, as you said before, and it's a true statement, believe in science, listen to their doctors, listen to the WHO, and have been self-quarantining in really, really important ways. If, as you suggest, that the virus does get out into the larger community in the Gaza Strip, Jamal, it will have a catastrophic impact on Palestinians living in Gaza, because it's among the most densely populated areas on the planet, number one. Access to medical care is severely limited because of the occupation. There's just a handful of ventilators. They don't have the medicines required to keep a person on a ventilator for an extended period of time. So I fear every single day when I get up in the morning and I check the situation in Gaza, I fear that the situation could spiral out of control. It's a very dangerous situation, and we're going to monitor it very carefully here on Arab Talk, obviously. But right now, it looks like the situation is relatively stable. We'll continue to monitor the situation. But you're right. If you look at what happens in Rikers Island, if you look at what's happening in various prisons in the United States, once one or two people get infected, it spreads like a mass contagion, even faster in prisons than it does, anywhere else. Actually, another analogy, Jamal, would be the rehabilitation facilities and senior living facilities here in the United States. Mm-hmm. And this is being underreported right now. The number of older adults who are living in senior living facilities or skilled nursing facilities, the numbers of older adults that are dying from COVID-related diseases or COVID themselves is astronomical right now, and we won't even know the full extent of it for many, many months, Jamal, because these are horrific and catastrophic places of infection that get no services, and by the time the ambulance gets to a senior living facility, it's frequently too late, and these are the people who are the most vulnerable. So the senior living facilities, I think, is another model to think about, God forbid, anything like an infection pandemic spreading in Gaza.
You're listening to Arab Talk on KPOO San Francisco, 89.5 FM. So just I want to now go back a little bit to the most recent news right here. And every day I'm like our jaws drop every time we listen to Donald Trump, or every time we watch one of his new actions talking about Gaza. Gaza was dependent for many, many, many years on the United Nations, the UNRWA, and the United States, as you know, has cut funding to the UNRWA and other UN organizations, so they are getting a fraction of the support that they were getting before. And now Donald Trump says that he would be cutting funding to the World Health Organization. So this is something new that we hear about. All
Unbelievable, Jamal.
And if we talk about this pandemic as a global crisis, you're just like going after I don't know if it's the only organization or the largest organization.
It's the only organization.
So basically, I mean, I don't know what to say. I mean,
well, here's what I can say. The editor of The Lancet was interviewed on the BBC yesterday and asked about the same thing. And I think his answer will be the same as my answer. If deliberately impairing the health and wellness of a large number of people is a crime against humanity, then defunding the WHO by Donald Trump can be considered a crime against humanity. And that's what the editor of the Lancet, the most prestigious medical journal in the UK and arguably in the world said on an interview with the BBC yesterday. I mean, the WHO is responsible for coordinating, Jamal, the global pandemic of the COVID-19. They are responsible, and not just for COVID, but for all pandemics, and not just for viruses, but for bacterial infections, and not just for bacterial infections, but they're the central clearinghouse that organizes policy for the health and welfare of the entire globe. And the United States is the largest contributor. They contribute up to $400 million a year to the WHO. And by the way, it should be noted, the United States hasn't been paying its share to the WHO for many years now. So they're in arrears quite a bit. Defunding the WHO right now is a crime against humanity, in my opinion, because it and this is what the head of the WHO said yesterday. It was very, very tragic thing that he said. Dr. Tedros said, when there are divisions in the world community against this war against the COVID-19 virus, when there are divisions, the virus will exploit the divisions among countries and leaders. And he's afraid, as I'm afraid, as we're all afraid, that this vicious act to defund the WHO could create an opportunity for even wider spread of the COVID-19 virus in places that were at this point either stable or at least flattening the curve a little bit. So to call it a political move, I guess, diminishes, Jamal, the kind of gravity of the decision. I do believe it's a crime against humanity because it's going to affect the entire globe. He wants to start blaming the WHO for his ineffectual decision making. He knew as early as November that there were concerns. He knew even more forcefully in January of the potential catastrophic effects of the pandemic, and he knew it in February and did nothing for a month. Basically, Jamal, we lost a month in the United States where he could have really put the brakes on things and really held back what the CDC and WHO wanted to do. And he wasn't listening to Dr. Fauci and the leaders at the CDC.
I don't think he still listens to them because he wants to restart the economy like beginning of May.
Yeah, so let me just say this really quick because I want to make sure our listeners get this. If the economy is open too soon and people go back to normal, that the risk of reinfection increases dramatically, substantially, and that you get new populations that will be exposed to the virus. You'll get secondary infections for people who already tested positive and then recovered could get reinfected. And now what we're hearing from virology labs in China is that it looks like the COVID-19 virus is starting to mutate. So, which means that new forms of the virus may be out there and beginning to spread. Let me just say,
wow.
Yeah.
Let me just ask you something about China, because I was reading about a story today. It started as rumors, but now it's picking up steam, saying, that the virus in China did not start in wet markets, but rather in labs.
Yeah.
How true is this story, or is it rumors, or...
Well, here's what we know. Number one, it hasn't been proven. But in 2018, a group from the WHO and from the United States visited a lab in Wuhan, China, that works on virus research. And when they went there, the researchers who were assessing this lab in Wuhan, China, had some concerns in 2018. And what they wanted to do is send back an educational team to go back to this lab and say, your hygiene techniques, your research techniques, your quarantine techniques need to be stepped up significantly because you run the risk of a spill occurring. And if a spill occurs, it could have a devastating impact. So we know that is something that happened in 2018. What we don't know is whether or not for sure, I mean, it's a possibility, but we don't know yet for sure with any kind of, weight of scientific backing, whether or not the novel coronavirus COVID-19 actually came from this lab or not. It's worth investigating. I mean, investigating the WHO, investigating China is fine. I don't have any problem with that because we always need room for improvement. My problem with what Donald Trump is doing is that he's doing the Israeli technique, Jamal, of collective punishment. So it's blaming the victim, it's blaming the WHO, it's collectively punishing the world population in order to kind of have a political gain, because Donald Trump is sinking in terms of being confronted with the reality that he acted too late, number one, a month late, and number two, to this day, Jamal, as of the date of our show today, he continues not to have a coordinated federal response, which is slowing down people's ability to kind of recover from this. And he wants to reopen the economy by May 1st. I just want to let our listeners know that in one of the states where they had relaxed, they didn't have quarantine, which is South Dakota. There was a pork processing plant in South Dakota, Jamal, that had the largest outbreak of COVID-19 infections.
Right.
300 out of 500 employees, and it looks like all of them now have tested positive, or close to all of them have tested positive for the COVID-19, because the governor of that state is kind of she's a Trump supporter, obviously, believed that it wasn't going to affect South Dakota. Well, here's breaking news. All of those states that didn't institute a shelter in place or a self-quarantine procedure, they've all got infections, they've all got deaths. They're going to be lagging weeks, if not months, behind the rest of the country in terms of what's going on. So, the new normal, Jamal, I just want our listeners to know this is really important what I'm going to say. Self-quarantining is good, wearing a mask is good, washing your hands is good, social distancing is good. But the only thing that's going to make us go back to some kind of normalcy is going to be a vaccine. And it's going to be most Americans and most people of the world are going to have to be vaccinated. That's going to be the only true and best and most effective way to get over this. Otherwise, people are going to go back to their, quote, normal lives, and we're going to go through another wave of infection. We're going to go through another wave of sickness.
I mean, it seems this is the road that we are heading to. Listening to Donald Trump and listening to actually other countries, including Spain, that started loosening the restrictions on people going out. So if we don't have the vaccine now, Jess, and a month from now we start loosening the restrictions, what's going to happen?
Well, here's what's going to happen. We're going to have the potential for another mass exposure and another even more catastrophic pandemic consequence, because people who thought they were safe are going to go out there, even if they have masks. They're going to get infected. They're going to come home. And the people that they live with are going to think everything's fine. They're going to get infected. So I understand that people are suffering horrifically economically, but instead of giving people a check for $1,200 and then sending them back to work, my feeling is pay people salaries for the foreseeable future rather than give them a $1,200 check.
Well, actually, most people have not received their $1,200 check and won't see that check for several months because Donald Trump insists on putting his signature on the damn check. So that's going to delay the process,
Right.
for several months for the people who need it the most, because the people who need it the most don't have direct deposits into their account.
Right. But I want our listeners to know you should still self-quarantine. You should still wash your hands. You should still wear a mask if you go out. But unless large numbers of people get vaccinated, we will never go back to the way things were before. The governor of California, Governor Newsom, is saying, okay, well, maybe we can relax some things, but you'll go to a restaurant and the waiter will be wearing a mask and gloves. You'll be wearing a mask, and there'll be social distancing in a restaurant. The mayor of Los Angeles, Jamal Garcetti, said, well, maybe we can have sports, but there'll be no one in the stadium. You can have people who can who can watch it on TV. Maybe the ball players, whether it's baseball, football, or basketball, can play, but you won't have people in the stands. Universities, Jamal, are talking about having no in-person classes until 2021. So,
well, I know that. Well, I know that for a fact because now San Francisco State University, where I teach, has requested for people and encouraged, teachers to submit online
yes.
syllabi.
So we're not. What I'm trying to say to our listeners, Jamal, is that we're not as close as Donald Trump says by any extent. Getting even parts of the country back by May 1st, before there's a vaccine, before we've seen the peak. We haven't gotten to the peak, in my opinion. In some places maybe, but not in all places. And this is the take-home message. Things will not go back to normal ever, in my opinion. But they will never go back to even remotely normal until large numbers of people get the vaccine. A reasonable vaccine is not even going to be available. A safe, effective vaccine is not even going to be available, Jamal, for a year. So you do the math. Will some people be able to go back to some kind of work? Probably. Will we be able to go back to the way things were before? Absolutely not. That's a fool's errand, Jamal. And we run the risk of further extending the catastrophic impact of this pandemic and this COVID-19 unleashing itself for a second wave of infection, which I'm very concerned about.
Well, what about, at least let's see if there is some light at the end of the tunnel about some positive news, things, experimental viral drugs, and they're talking about the plasma treatment.
Yeah, that's right. So here those are not cures. So the antiretrovirals and the plasma treatments. So what the antiretroviral does, the Gilead drug Risemavir, which has been shown when it's given to people, it stops the majority of the COVID-19 virus from self-replicating. It's the self-replicating of the virus that causes so much damage. So this doesn't cure it, but it slows down, it looks like, or stops the replication of the virus to much more manageable levels where people can recover. That's the good news. The bad news, it doesn't do that for everybody. The plasma treatment is you take a person who's been exposed to the virus. They recovered. They develop the antibodies. You extract the plasma from the person who's recovered from the corona infection. You take his or her blood and plasma. It has antibodies in it that are believed to be very effective. You inject that in someone else, and that helps that person's immune system develop the antibodies and develop immune response to help them get over the corona infection. It's worked in a couple of limited settings, Jamal, but it's the same thing. It doesn't work for everybody. So these are treatments that can treat some of the symptoms, but it is not a cure. I want to keep emphasizing that. The only true way we're going to overcome this is with a solid vaccine that reaches a critical mass of people so that we can stem the spread of the virus over time.
And do we know that this is going to be, do we have a timeline for this?
12 months, 12 months to 18 months.
That's the same timeline we've been hearing about for now the past few weeks.
There's no way you can make it go faster. And
why is that? I don't understand.
Well, if the way the scientific method works, Jamal, is that you have to take large numbers of people who are not who don't have symptoms, who have not been infected. You give them the vaccine, they get infected, and then you see how they respond to it. And then you have
so it's not the bureaucracy factor.
No,
it's approvals by the FDA and all these things that take a long time.
Because you have to do the double-blind study. You have to give some people vaccine, some people don't get the vaccine. Because the only thing we have to help us get through this is science and medicine. And if you don't believe in science and you You make decisions based on your gut, which I know Donald Trump likes to do. You're going to make stupid, ill-informed, unscientific decisions.
Well, Donald Trump was saying, "Oh, this is something like the flu. It's going to disappear on its own by April."
He's delusional. He's delusional, and I'm sorry to say this. Any religious leader who believes that God is going to save them from the coronavirus is also delusional. Of course, we hope that God would do that, but at this point, God is not intervening, Jamal. People who are going to these religious services with Easter, and Ramadan is coming up next week. People need to shelter in place, and they need to still practice these things. Actually, I see that we're running out of time, Jamal. Boy, we really talk about. We get through a lot of material here on Arab Talk, of course.
Yeah, that's right. And I want to talk briefly about the Arab American community. I've been trying to gather some information about what's going on. I know in the Detroit area, your hometown, Jess, that they have been setting up, some organizations to kind of reach out to the Arab American community and make sure, and helping the state to, to send some people or to send some literature, at least in Arabic, to the new immigrants.
Yes.
And also the religious leaders, both Christians and Muslims, have been very forceful at telling people to stay at home. They're not going to celebrate Easter in churches. Some of them were holding Easter masses on Zoom. And also now with Ramadan coming, as you know, Ramadan is not a one-day holiday. It's a 30-day, and then there is a holiday followed by a holiday. So you're talking about almost 35 days of family gatherings and extravaganza, and that's a major.
Yeah,
and people, of
and
course,
it's going to be on Zoom this year, Jamal. It has to be. You're going to have to do Taraweeh. You're going to have to hear khutbahs. You're going to have to do all that stuff on Zoom, and stay protected. But we're going to continue to follow all of this, Jamal. Our commitment to our listeners and our viewers, even though we're still continuing to self-quarantine, we're going to continue to do Arab Talk on a weekly basis. We encourage our listeners to reach out to us. You can tweet us, Arab Talk Radio on Twitter. You can go to our website, arabtalkradio.com. You can watch us live on Jamal's Facebook page, Jamal Dajani 2. So we are committed to our viewers and our listeners, Jamal, and we're going to continue to follow this until the foreseeable future.
That's right, Jess. You've been listening to Arab Talk Radio on KPOO San Francisco, and we also ask you to support KPOO. It's keeping basically our show on the air and many other shows. And in these very difficult times, go to KPOO's website and see how you can support them in any which way that you can. And we will talk to you next week.
We'll see you next week.